Hey YouTube, so today I'm going to do a bit of a rant, and it's about masks and the way people think. So I'm an RN with 30 years plus experience. Most has been in some type of intensive care or cardiac cath lab. Now, I have also worked in the industry of medical device and pharmaceuticals. I'm also an adjunct professor for the last 9 years as it relates to pharmacology, hemodynamics, etc. Now, please know that I have no political influence when it comes to healthcare. I think many people look to doctors and nurses and pharmacists for medical advice. And when there's a crisis going on, I feel like it's my duty to give information, followed by informed opinion. Now, I talk with healthcare professionals on a weekly, if not daily basis about COVID-19. I have the benefit of talking with people that are infection control, of people, meaning doctors who take care of patients with COVID-19. I have the experience of doing procedures on patients with COVID-19. So when I tell you that masks are one of the things you should do to help prevent you and other people from getting sick, it's not just made up information. Most people in the medical profession advise wearing a mask around other people to protect them from you and to protect you to some degree from them. Yes, the COVID-19 virus can travel through regular masks, but it's often carried on larger carriers, like all the gross stuff that exits your body when you cough or sneeze or yell. Now, people that don't want to wear masks seem to fall into two broad categories. The first is they find some secondary information from someone in the medical profession that you should or you should not do, fill in the blank. Whatever relates to social distancing or wearing a mask or whatever. Remember when people said, you should start smoking because COVID-19 doesn't affect smokers like it does everyone else. That's how far of a reach you can get. Now, granted, there's a lot we still don't know about the virus, but this is one strange and wicked virus. It's starting to affect more and more young people, when before it was thought just to be an old person's disease to worry about. Most doctors and nurses think you should wear a mask to protect others and yourself. Can you find some people that think otherwise? Yeah. But they're a minority. Can you find people that think unprotected sex is just fine too? You can always find somebody that has any view you want to find. Now, I have to wear a mask the entire day, and I have to wear a face shield with any patient interaction. Now, we don't do these things at Baycare because we have one political belief or the other. It just makes good medical practice sense. The other group of people seem to fall into the category of, you can't tell me what to do. It's my constitutional right not to wear a mask. Now, there are many things that we have to do by law, and there are many things we should do because we're smart or because we care about other people. It's like if you have active HIV or syphilis and you knowingly have unprotected sex with another person. Well, it's just wrong. I don't know if that actually breaks the law, but you should not have to have a law to tell you to not do that. Now, people wearing masks has to be an accepted mode of thought for it to be successful. It reminds me of when seatbelt laws started coming into play when I was a teenager. I remember people saying, you can't make me wear a seatbelt. Well, they saved lives. And finally, over many years, it became accepted. And yes, you could get a ticket for not wearing a seatbelt. Now, like I'm a skydiver, so I assume a risk. The difference here is that I will only hurt myself if something goes wrong. As the saying goes, your right to swing your arms around, it ends at the tip of my nose. So if you have a right to do things, but you don't have a right to infringe on other people's rights. You can drink, and you can drive, but if you put the two of them together and you're caught, well, you're going to go to jail. One health issue has been vaccines lately. People saying, you can't make my kids get vaccines. Now, I don't keep up with kid stuff, and I don't know if it's mandatory now, but when I was growing up, I guess you could not get a vaccine. People didn't think that way. But you couldn't go to public school. When I went to nursing school, I had to prove that I had vaccines or I couldn't get into nursing school. There was one job as an educator at a pharmaceutical company I had to prove I had vaccines and hepatitis B vaccine. My titers were low, so I had to get a booster. Measles, mumps, rubella, polio, it's been a thing of the past. I knew one kid growing up that had it. My stepmother, she had polio as a child, but it was almost gone by the time I was growing up. Polio was devastating, and there was a reason it was mandatory to have the vaccine. I saw a post the other day about people asking people to wear a mask after there's been an outbreak. It's like asking to wear a condom after you got your girlfriend pregnant. Well, it's really a better analogy to be like, you had unprotected sex with 5 people this month and 3 of them are pregnant. And if you have your way, you're going to have sex with 5 other people this month. So the message is, wear a condom this month. That's a better analogy. So please, wear a mask. Now, one of the best ways to not get a contagious disease is to stay away from the source of that disease, or the person. But that's the problem. You don't know who has it or hasn't gotten sick yet, or they're an asymptomatic carrier. It's all about the viral load and how much exposure you get to that viral load. Is COVID-19 mainly spread by aerosolization? Is it by droplets? Is it by contact with infected surfaces? We're still learning. But the droplet transmission is becoming more and more accepted, and that's one way masks will protect you. Listen, we learn and we adapt and we change strategy. Least you think this is strange about COVID-19? Let me show you about Code Blue. I was an ACLS instructor, Advanced Cardiac Life Support instructor, for about 10 years. And what we do in a code then is not what we do in a code today. There are medicines that are now downplayed, or medicines that are never even given that were given 20 years ago. Why? Because the American heart studies these things and adapts, and they do evidence-based practice. And that's what you're seeing here, adapting as we learn. So is there some change from what we did with COVID-19 3 months ago? I sure hope so. Is there some change from what we did 2 months ago? Please, yes. How often we change your IV site or your IV tubing or your catheter care, or how soon we get you out of bed after surgery. It changes. So when I say wearing a mask is in your interest and the interest of people that you know, that's exactly what I mean. Now, I'm not saying we should shut down businesses. I'm not saying this group of politicians are right or this group of politicians is wrong. I'm just saying it as a nurse that masks are helpful. Now, my posts are meant to be informative. So when I talk about masks and then somebody gets in the comments and they talk about their love or their hatred of the president, it's nothing to do with what I'm talking about. What I'm talking about has nothing to do with guns, it has nothing to do with abortion, has nothing to do with religion, or whatever we want to turn my post into. This is the way I think. Most people don't care what my opinion is about the president or abortion or guns or God, etc. But this COVID-19 is new and it lands in my profession. This is what we do in the hospital. We deal with the sickness that this disease brings. And if you think it's about mortality only, there's a whole lot of pain and suffering and residual deficits, sometimes for life. Residual deficits, that's a fancy medical way of saying your quality of life is fucked from this point until the time you die. So I say, do what you can to stay healthy. Do what you can to help others that you care about stay healthy. Wear a mask around people.